got once again the honour to present Merryn Jones. Merryn began her training as a registered general obstetrics nurse back in 1981. She has enjoyed a variety in her nursing career, from burns nursing, practice nursing and occupational health screening, needs assessment and hemodialysis nursing. In 2014, she took on the role of renal transplant coordinator at the Hawke's Bay DHB and completed her Masters in Nursing Science at Victoria University in Wellington back in 2017, with her Master's thesis titled "It's Hard to Ask: Examining the Factors Influencing Decision-Making Amongst End-Stage Renal Disease Patients Considering Asking Families and Friends for a Kidney." Her research findings were published in the New Zealand Nursing Journal, and she has presented both in New Zealand and Australia at the Renal Society of Australasia and the Transplant Nurses Association conferences. In October 2019, Merryn organised the first regional transplant hui, exploring Māori attitudes to transplantation, and this hui received NZ-wide media attention. She is an associate investigator in the ASSET, or Assess and Equality in Transplantation study, aiding in understanding and disseminating the impact of ethnicity and other social determinants on access to transplantation in New Zealand, and is also one of the members of the Aotearoa Guidelines Writing Group for the Akachari Guideline Management of Chronic Kidney Disease amongst Aboriginal and Torres Strait Islanders people and Māori. Today, Merryn Jones is presenting Valuing Organ Donation in a Māori Cultural Context, Reflections on a New Zealand Regional Transplant Hui. Kia ora.
Tēnā koutou e hoa mā, ko tai mai nei I tēnei wananga. Ko Merryn ahau, no tamaki makaurau ahau, engari ke HERETAUNGA ahau e noho ana. Nō reira, tēnā koutou, tēnā koutou, tēnā koutou katoa. My name is Merryn, and my tipuna Ngāti Rakai Pāka from Mōrere and Nuhaka in northern Hawke's Bay. I grew up in Auckland and started my nursing training at Middlemore Hospital in 1981. For the last 6 years, I've worked as a renal transplant coordinator at Hawke's Bay DHB, and prior to that I was a dialysis nurse. This beautiful wahine in this photo was one of my dialysis patients. She passed on within a year or two of this photo being taken, too young. Māori life expectancy is around 10 years less than New Zealand Europeans. Our stats for diabetes, renal and cardiovascular disease are poor, all of which impacts on our transplant rates. 70% of the dialysis patients in Hawke's Bay are Māori and most are diabetic. These are similar stats to Waikato and Northland, but there will be very different demographics in, say, Southland or Christchurch. I completed a master's thesis exploring the lived experience of patients who are eligible for transplant. I interviewed patients in our renal service who were either already accepted onto the deceased donor waiting list or who had a living kidney donor being worked up for them. Some were on dialysis and some were nearing the need to start dialysis. In keeping with our dialysis population demographics, 70% of the participants I interviewed were Māori. They were asked if they'd ever approached family and friends for a kidney, and just as important, the reasons why they might not have approached anyone. These were some of the things they said. We often see poor health in Māori and Pasifika families as a result of genetic predispositions to things like diabetes, gout, hypertension, and lifestyle can have an impact too. Even if they're able to recruit family members, there's a high likelihood of discovering problems during screening for our Māori and Pasifika people. This is also true for families with polycystic kidney disease. Almost half of the patients I interviewed with end-stage renal disease had never talked to anyone about needing a kidney, and many stated that they had been put off by others who had given them misinformation or stories of things that had gone wrong. Some walked out of the doctor's rooms knowing that they would never talk to anyone about their need for a kidney, even though their doctor had said that they were well enough to be transplanted, and encouraged them to talk with their whānau. But for many of the participants that I interviewed, they knew that so many of their family were sick. They said, "Who would I ask?" After my paper was published in the New Zealand Medical Journal, I had several interviews, ABC Radio in Sydney, along with Dr. Shilpa Jasudison, who is the Clinical Director of Kidney Health Australia. And she said that similar issues existed for Australia's Aboriginal and Torres Strait peoples, and their transplant rates were very low. I also presented my findings in Auckland, Sydney and Melbourne at the Renal Society of Australasia and Transplant Nurses Association. If we look at the 187 kidney transplants across the whole of New Zealand in 2017, only 23 or 12% of the recipients were Māori. Of those 23 transplants for Māori recipients, the majority received kidneys from the deceased donor list, so 17 of those 23 were from the deceased donor list. Only 6 Māori patients across the whole of New Zealand received a kidney from a living donor, out of a potential 69 living kidney donations that year. There's some big picture stuff I want to weave in here because these issues have an effect on our ability to successfully transplant our Māori and Pasifika patients, as well as find suitable living kidney donors. Just looking at this last point for a minute, you can't donate a kidney if you have diabetes, and for some of our patients that means that no one in their family can donate. And this, sobering. Which brings me to this quote from Northland GP and 2014 New Zealander of the Year, Dr. Lance O'Sullivan. He said in a 2016 interview that we need to talk about organ donation, particularly in Māori communities. My research participants identified unmet need, but they also informed about what would help. I then grouped this information into potential strategies that could provide better support for our people. As a result of my research, our clinical psychologist and I have developed a culturally appropriate psychosocial screening tool that examines willingness and motivation to pursue transplantation. We're ready to pilot it, and the intention is that it will replace the American tool currently in use. We know from other research that where whānau are involved in treatment decision-making, there are improved outcomes for the patient. We also know that early referral to renal services with early intervention and patient education can delay the progression of end-stage renal disease, so educating primary care health providers is important. Generally speaking, the public have a poor understanding of the circumstances whereby organs can be donated. So we need to educate people about why there's a scarcity of organs available for donation, irrespective of the fact that a lot of people have organ donor on their driver's license. I thought that we could group some of these strategies into one activity, and that's what led to organising a transplant hui. I've been working closely with our Māori Health Service for many years in dialysis and relayed my findings to friend and colleague Shane Taho, Kai Takawainga. I told him I thought having a hui to openly discuss transplant with the Tao Māori view would be a good starting point to generate discussion. I started presenting to different groups to gauge support. The Māori Relationship Board and the Consumers Council gave me some really good advice. They told me to ensure the hui was non-clinical and to keep it very story-driven. To have the hui at a venue that Māori would be happy to go to, away from the hospital. So the next slide shows some of the people who formed my small committee as a result of these meetings, and these people also were fantastic, leading the hui on the day. Shane, friend, colleague, and MC extraordinaire. Hauera, Kaumatua, and Nada Hayes, ICU link nurse, who I picked up as a result of the Māori Relationship Board presentation. Kaumatua, Hauera and Tiwana, along with Nan, who organised all the waiata. Doing everything on the cheap, my graphic designer son designed the poster and included Ngāti Kahunganui's primary monga, Kahurunaki. The DHB did the colour printing in-house. Planning the hui took a good 9 months, sounding out speakers, arranging venue, catering, music, advertising, etc. A highlight for me was that we decided to give a living and healing gift to each of the speakers. So we gave a kawakawa plant and a kete and some kawakawa pani that the daughter of one of our patients made for us. There were lots of interviews. I wrote a statement for our media people at the DHB, and about a week before the hui, they did a press release which got picked up by TV, radio and newspaper editors. Aside from all the last-minute jobs, I needed to do a lot of arranging interview times and obtain written consents from the people that TV3's Ruani Pereira was going to interview over a 3-day period for their program, The Hui. We had registrations for 100 people, but because of the weather bomb, some couldn't come. There were about 80 in total braving the storm. Nan said that the rain represented the time of separation of Ranganui and Papatuanuku, and the rain was Ranganui's tears for the loss of Papatuanuku, and that put a lovely positive spin on a really foul day. This is people starting to assemble, and Hauera doing the Miki Whakatau. He talked about the naming of the hui, so I'll just let you read this. Paitara o te ora came from Ngā Motiatia, and Hauera and Tiwana thought very carefully and studied verses to find an appropriate title for our hui. I think they did really well. I had tried to secure Ngāhiwi Tomoana as leader of Ngāti Kahunganuiwi to open our hui, but I was told by his secretary that he would be away, so I arranged for one of his board members of Ngāti Kahunganui to speak in his place. However, he showed up on the day. Just amazing. He gave an impromptu speech about organ donation in the context of Māori creation, and how Ranganui and Papatuanuku's 70 Atua children had all given a small part of themselves in order to create the first man. and so Māori had always given of themselves to help others. And as if that wasn't enough, he then held up his driver's licence with donor on it, and I thought we could probably stop our hui right there. We didn't have to do anything else. Job done. Waiora then did her part, not as we hadn't planned that Ngāhiwi was going to be there, so she's a well health champion and spoke beautifully as well. So here's our kaumātua at the front with Ngāhiwi and Waiora leading pene pene. Our people led this hui with a tikanga focus, songs, stories, lots of tears and laughter, and these next slides will give a snapshot of the day. Annie Reynolds, nephrologist, provided the context for transplant, who can get one, when and why someone might have one, and the difference between deceased and living kidney donation. Dr. Emma Mary is a pain and palliative care specialist, but also an intensivist. She very sensitively talked about those difficult organ donation conversations with whānau at the bedside. Wikitoria is a beautiful Ngāti Kahungunu woman and author who lives in Auckland. She had to make a difficult decision when her son was on life support and chose to donate her son's organs in order to give life to others. There wasn't a dry eye in the house at the end of Wikitoria's talk. Nada Hayes is an amazing nurse who works in ICU and is one of the Organ Donation New Zealand link nurses who talk with whānau about their wishes to donate their loved one's organs, or not as the case may be. She conducted a survey of the 52 medical staff that work in ICU as to their attitudes to broaching the organ donation conversation with families of patients who are on life support and deemed brain dead. And her survey found that only around 4 to 5% of health professionals she worked with felt comfortable with talking with Māori whānau about organ donation. This would indicate that health professionals need more training in how to broach the subject, but also asks whether opportunities to donate could potentially be missed simply due to misconceptions about Māori donating organs. Naira Haka, Nurse Director of Māori Health at Hawke's Bay DHB, thanking Naida for her work. And a team of hospital and community nurses also showing their support for Naida. Charlie received a deceased donor kidney in 2011. He shared his personal journey to transplant with us all. All of his 7 brothers died in their 40s and 50s due to comorbidities from unmanaged diabetes and hypertension, leading to renal and heart disease. When Charlie got his transplant, he was accepting a kidney on behalf of his brothers who had gone before him. Unfortunately, in March this year, just 6 months after he spoke and was interviewed on TV3's The Hui, Charlie passed away from heart failure. I first met Charlie in 2008 when I was his dialysis nurse, and having a transplant gave him 8 years free from coming into the hospital 3 times a week. Charlie spoke about his life on dialysis and the difference transplant had made to his quality of life. Curtis Walker is a nephrologist at Mid Central DHB and chairperson of the New Zealand Medical Council, and I believe the only Māori nephrologist in New Zealand. Curtis speaks te reo. He is political, articulate, funny, and passionate about health inequities. He put Māori health inequities into a historical context and provided data on transplant that showed we need to do better. This kaumātua from the audience got up following Curtis's talk and gave a rousing speech to tautoko Curtis's work. And a few more shots of people enjoying Curtis's presentation and Hawera thanking Curtis. David, Rachel and Annie next presented their research into Indigenous experiences and perspectives of kidney transplantation. All are highly acclaimed researchers, and Professor David Tiffany Leach is Head of Māori and Indigenous Research at EIT, GP in Hawke's Bay, and holds a New Zealand Order of Merit for services to Māori and health. The morning session focused on deceased organ donation, with Wikatori and Charlie sharing their lived experience of deceased donation from the point of view of whānau and of recipient. Many of my Māori patients dislike the reference to deceased organ donation, and the name can be a barrier to agreeing to go on the list for some. So just before lunch, I asked everyone to have a think about what alternative names could be given to the deceased donor list that might better represent a Māori viewpoint. Every seat had a pen and pad of paper, and I asked people to put their suggestions in the kete by the end of the day. The kete sat on the whāreki mat at the front of the room next to the kawakawa. These were some of the suggestions that people provided. There's a lot of positives there about gifting, recycling, sustaining, rekindling. Really positive words as taonga, well away from the word deceased. Quite a mind shift. If the morning was dedicated to deceased organ donation, after lunch we focused on living kidney donation. I got the ball rolling talking about my research and why it was important that we discuss transplant in a Māori context, but the highlight was the living kidney donors and recipients who shared their stories. Ed and Ngāmihi shared Ed's journey to transplant, a living kidney donation from his brother. At the end of Ed's moving talk, they both sang a beautiful waiata. The next whānau were incredibly moving. Anaru came to live with his big sister Tanya in his teens after years of living in foster care. He said that she saved him and his younger sister. She was also the main income earner and the heart of their family. Anaru is normally shy, but he willingly agreed to talk to a room full of strangers to say why he decided to donate. Donating his kidney wasn't an easy decision for him to make. He thought very carefully about it and prayed hard. In the end, he decided he would do what he could to help his sister, as she had done such a lot for him. It turned out that he was fit and well enough to donate and was a good match for his sister, who by this time was on dialysis. Tanya and Anaru's whole family came up to support them, including their younger sister, Rarotongan grandma, and Tanya's husband, Tyrone. And Tyrone had us all laughing. And then they sang for us. Sophie was fast approaching the need to start dialysis when her mum and aunt, who were vying to donate a kidney to her, were ruled out as potential donors. Sophie didn't want to accept a kidney from her boyfriend of 2 years, Tama, but then he offered to be worked up, knowing that his mum might not be happy and that it might end a promising professional rugby career. It turned out that Tama was a good match, and 4 years ago, Tama willingly donated a kidney to his girlfriend. Sophie hadn't expected that Tama would speak, as he's shy, but he took the microphone and shared why he donated. I think he was really moved by the aroha in the room and by the others who had also shared their stories. Tama and Sophie are now married and have baby Ahi. Sophie agreed to be interviewed on the hui. Tama's parents joined Sophie and Tama to sing following their talk. To end the afternoon session, my colleague Janine Palmer, who's a nurse practitioner in renal, talked about providing care and support for our patients post-transplant. Her presentation focused on recovery and lifestyle changes post-transplant and the support that's needed from GPs and practice nurses, community healthcare workers and whānau. Communication between patients and their support networks is vital if we are to successfully get the person through the lifestyle changes that our people face post-transplant, such as high fluid intake, taking twice daily medications, and staying sun-smart. Some people need very little support and advice, and others need a lot of support depending on their individual health literacy. The hui generated great discussion about transplant in a Māori context, which was the aim. The consumer stories were really well received. The hui was a day of tears, laughter, sharing stories in a safe and nurturing environment. The catering was excellent and the feedback forms were positive. I loved this feedback. It's so true. This project was significant on many levels. It was the first transplant hui of its kind in Aotearoa, New Zealand, whose target audience was Māori healthcare providers and influencers. Through highlighting the needs of our renal patients and by talking about organ donation generally, we raised awareness of an issue that disproportionately affects Māori. Through sharing stories, empowering others and listening to those who work with our Māori patients and their whānau in the community, we all learn. Through providing knowledge, we help to upskill those who attended the hui. And we better support our patients who face an often difficult journey towards transplant conversations or the receiving of a deceased organ. Nō reira, ko taku iti nō nei, tēnā koutou, tēnā koutou, tēnā tātou katoa.
Kia ora. Thank you very much for that, Merryn. And I believe you're on. Are you online there, Merryn? Can you hear us?
I am.
That was absolutely outstanding. Thank you for that. I'm a little bit blown away. There's some quotes there that you stated. I'm just going to say something from Angela Clark. Very moving quotes from people. Thank you to those participants for sharing, especially the one about the chainsaw. If I can't borrow a chainsaw, a gentleman that passed away not that long ago said the exact same thing to me, and it was so it's kind of hit it on the home.
That was a very strong farmer, and you know, everyone has their backstory, and for him, you know, I was really moved sitting there listening to he and his wife in their kitchen saying, you know, how can I approach anyone? How can I even ask if I can't even ask a neighbour to borrow a chainsaw? And it's so true, you know. A lot of our people are so whakamā, they're so shy to actually bring up their need for a kidney with others. It's a very difficult subject to broach.
Very much so. I've got a question from Auntie Esther. Would you have any Pacific perspectives on organ donation in your study?
Yeah, we had only one Pacifica person in our study. Denise Beachy at Middlemore Hospital has done some research into Pacifica viewpoints, and so I don't know if it's a published thesis, but certainly if you were to contact Denise Beachy, who's a clinical nurse specialist at Middlemore Hospital, she'll be able to help you with those stats. Actually, Pacifica are doing better than Māori is with regards to living kidney transplantation. So,
Oh wow, that's Okay.
There's been a recent upsurge.
Yeah. Right. From here, we are going to, I think that's all we've got. Oh, hang on, no, I lie. There is one from, Auntie Margaret. Thank you so much. Especially with Māori and Pacific Islanders who are less likely to receive a kidney, how can we work together to be advocates and change the outcomes for Māori and Pacific Islanders?
Kōrero. Basically, we need to talk more about this need. Media campaigns are fantastic, but we also need to, the more media attention makes it easier for people to then disclose their need for a kidney. Many of our patients say kidney disease is quiet, it's hidden, it's not sexy, perhaps like, there's the Heart Disease Tick or the Cancer Foundation, Cancer Society drives Daffodil Day, Blue November, those sorts of things, breast screen. Aotearoa's drives with the pink ribbon and things. So, no one talks about kidney disease. So by highlighting the fact that there are people with renal disease out there, every time there are media articles like about John Alomu or King Tuheitia or Georgina Bayer, so high-profile people getting kidneys, it makes people talk about it, and it makes it easier for our patients to say then, actually, I've got renal disease too, or that's happening to me too, and I need a kidney as well. So the more we talk about it, the easier it gets for our patients.
No, outstanding. Thank you so much for your time, and thank you for being online and then sharing that wonderful story. You're absolutely amazing. Please keep up the good work.
Yeah.